So it gives me great pleasure today to welcome Dr. Sonia Karani, who's a PhD researcher and physiologist at ASV Santé and the Pediatric Non-Invasive Ventilation and Sleep Unit at the Necker University Children's Hospital in Paris, France. Do you ever change the type of ventilator that you use with a patient? And if so, in what situation?
So yes, it happens a few times. For example, always the same thing, these flow detection issues. You start because why it's important for us, because we are doing a lot of outpatient visit to set the CPAP, for example. NIV, we try to do it during hospitalization, but for CPAP, as we don't have the choice, we usually set it during outpatient visits. So we usually think about the age of the child and try to choose the ventilator that will be more adapted for the child and the family. And sometimes we'll think that the child is old enough to be able to have a standard CPAP device. Seems to be much more than 10 kilo, for example, if we will choose an NIV device for CPAP ventilation. And for example, the child weight is about 15 kilograms, and the NIV device for CPAP should detect the patient above 13 kilograms. And so you feel comfortable thinking that it will fit perfectly, that will be okay. Then you start CPAP, the child goes home, and then you see him for another outpatient visit, and you get the data from the car, and see it on the inbuilt software, and you see that you have a big issue of flow detection. So it's very difficult because you don't know if the CPAP is set correctly, you don't know if you have to increase it. Usually we won't talk a lot about monitoring, but we always do a capnography so we can see concerning gas exchange if it's okay or not. But what we like to do, because we are seeing the children during outpatient visit, is to have a look at the inbuilt software data and at the flow curves and the pressure curves. So if you can do it, that means that if you want to be able to follow correctly the child, for example, the capnography was not perfect, you don't understand if you still have some obstructive events, you would like you will be happy to see correctly flow detection. So you can change the device and, for example, try to put intermediate or level 2 device. And if it's not enough, you will try life support device. So this is one of the case. Another one is that sometimes, according to the pathology of the child, according to the exam that we did, polygraphy, polysonography, capnography, that we did at the hospital before we start CPAP or NIV, we are quite confident that we will start CPAP for this child. But it can happen that sometimes CPAP won't be enough, you have to push a lot, and you put, for example, standard CPAP that is doing only CPAP therapy, and you see that it's not enough for the child, you have to switch it for NIV. So that means that you have to change the ventilator. We had some cases with patients with NIV that were put under an intermediate device, and because of the pressure, it was so NIV with so IPAP, EPAP, because of the IPAP level, the child and the brother or sister that was sleeping in the same room, or even sometimes the parents, felt that the device was too noisy. So we know that some devices who can do exactly the same job are less noisy than other ones. So we sometimes change the device because of this. And the last point, but maybe there are other points, but for us according to our experience until now, this was the main issues, is because the child is growing. And for example, you have an infant that required CPAP or NIV that you put on life support, and this child still need NIV or CPAP for a long time, and is growing, and then you don't need anymore to keep him or her on a life support, and you decide to change. What is the main point of this change is just because for the family, it's very easily because you don't have anymore the life support with the external humidifier, but you have everything less heavy, which takes less place, and you can have a inbuilt humidifier. It's just a question of practicability.
That's some brilliant top tips. I just had a couple of questions around ventilators. Do you ever find that, or CPAP machines, but mainly ventilators, that some patients find it difficult to swap just because they are so used to their ventilator that they have, that sometimes when they become discontinued and you have to replace them with a different one, they don't like it?
Yes, we had one or two experiences like that they say that it's not exactly the same, they don't feel exactly the same, but sometimes it's a question of readjusting the parameter. And your point is very important, because yes, if you train the device, you have to, much more if it's NIV. If it's CPAP, usually that's okay. But for NIV, you have sometimes just to readjust the parameters, because a slope of one with one device will not be exactly the same slope one for another one. The same thing sometimes for trigger, the same thing for other parameters. So it's important, because sometimes it's just a question of adjusting only one parameter or two parameters to make the child feel more comfortable with this new ventilator. So it's very important to recheck and to ask again.
And my final question is just with regards to if a ventilator needs to be adapted so it can fit on a wheelchair, and you know the patient is going to need that, how important is it that manufacturers, regardless of who they are, but they provide the accessories to do that easily for you?
Yeah, usually we try to choose the ventilator according to these points also. We use on the wheelchair, is it comfortable for the child? Is the bag of the ventilator easy to manage? Usually we will try to give two ventilators, but yeah, we pay attention to all the details. For example, if the child needs mouthpiece ventilation, you have to have everything that is well adapted. So it can be a question of a bag, of ergonomy, to choose one more than another ventilator. And another point that is very important for us is the software, the inbuilt software of the device. Sometimes we will try to choose one ventilator instead of another, because the software is more user-friendly, it's more easily to get the data from the home care provider, but also for us here. So this is also one important point when you choose a ventilator.
Thank you, Sonia, for spending the time talking to me this afternoon. I've learned so much, and for people watching this recording, there's been so many top tips for them. Thank you.
Thank you to you. It was very nice to try to help with the people with our experience, and thank you again for inviting me.